Hello everyone. In this video I'm going to be talking about blood sugar control and diabetes. Now, control of the blood sugar is part of what we call homeostasis. Now, the definition for homeostasis is the maintenance of a constant internal environment. And by internal environment we mean essentially our blood and tissue fluid. It's the way that our body regulates all the mechanisms within it essentially. Now, in a previous video, I've referred to homeostasis in terms of temperature control and how we respond when our core temperature rises or falls. In this video, we're going to be talking about blood sugar because this is very finely controlled in the body. So this is our second example almost of homeostasis. So what we have here on this first image, I mean, it looks a little bit unclear, but it's what I show my students when teaching this topic because this is the pancreas. It's sometimes referred to as the leafy looking organ because it looks a little bit like a leaf shape on diagrams, and it's responsible for the production of the hormone insulin, and that's critical in controlling our blood sugar. The pancreas itself, not a relatively large organ, it has a head, a body and a tail, and there's a specific patch of cells that release the hormone. Now, blood sugar control is taught at key stage 4 and 5. So in this video, I'm going to first of all talk about it at a very base level for key stage 4, and then go into a little bit more detail that would be expected at A level. One key thing to say though is why controlling the blood glucose is so important. If our glucose level goes too high, the water potential of blood can dramatically change. You have what's called osmosis. It's the movement of particles of water specifically from where they're in high concentration to low concentration. And by changing the amount of glucose in the blood, you change those osmotic gradients. It can lead to severe dehydration because if you have more glucose in the blood, technically we say there's almost like less room as such for water. So it would draw water in. So it would draw water out of the cells into the blood. But conversely, if our glucose falls too low, we're starving our cells essentially of the respiratory substrate, glucose. We need glucose in respiration to provide energy. So we are actually depriving our cells of that substrate needed, and the cells could die as a result. So clearly it's important for the body to maintain an appropriate amount of glucose in the blood, which is actually around about 90 milligrams per 100 centimetre cubed of blood. Now that kind of fact is something that would only really come up in key stage 5. You don't really need to know that at A level. So what I want to do is just explain the basics of blood sugar control to start with. So let's imagine we have just normal value. So we've got normal concentration of blood sugar. So we're going to draw this as sort of like a feedback loop. So we've got normal blood sugar concentration over here. Now, if our blood sugar rises, so if our blood sugar increases, let's say that we've eaten a particular carb-rich meal and our blood sugar level goes up, then the pancreas, we'll just draw the pancreas, a bit of a leafy shaped organ here, we'll just colour it in. It's a very rough sketch of the pancreas here. Then what the pancreas will do is release a hormone called insulin. And the job of the insulin from the pancreas is to lower blood sugar. So what it actually does, that insulin, it will push glucose into the cells. So it actually pushes the glucose into the cells, But also, one of the key things that does is in the liver. So in the liver, it takes that glucose and it converts it to something called glycogen. So that insulin helps to convert glucose to glycogen, which gets stored away in the liver. And the sole aim of that is to basically restore normal blood sugar. Now conversely, if for example we skip a meal and our blood sugar goes lower, or we are doing vigorous exercise and we've used up a lot of our glucose stores in respiration. So if our blood sugar this time decreases, then instead, instead our pancreas, just for completeness sake, another rough sketch of pancreas, then our pancreas will not produce insulin. We don't want it to produce this hormone. So as a result, we won't be pushing any glucose into our cells to get it out of the blood, but instead we take that glycogen and we turn it back into glucose. Now, a substance called glucagon does that. So glucagon turns glycogen back into glucose and puts it back into the blood. So we use those liver stores of glycogen and we turn them back into glucose to raise our blood sugar. Or we try and raise our blood sugar ultimately to restore it again back to normal. Now that typically is what happens in the body. That's how we control our blood sugar level to keep it at around 90 milligrams per 100 centimetre cube. What I want to do now is just to show a little bit more detail what happens, and this is predominantly for A-level, so key stage 5. So just go into a little bit more depth about this mechanism of control. So what I've done here is put together this flowchart which I'm going to talk through. It's pretty much just more a built-up version of what I've just been describing already. So we have in the centre our normal glucose value. So right in the middle, this is our normal blood glucose level. So like I did in the previous flowchart, we'll imagine that the blood glucose is raised. Now, there is a patch of cells in the pancreas called the islets of Langerhans. And what I've done in the middle at the top, I've put this diagram to show this kind of patch of cells, and you can see there's some capillaries in the middle. We've got some red alpha cells, so some red alpha cells around sort of the outside. We've got these orange sort of beta cells that are predominantly in the middle. This rise in blood glucose is detected by those beta cells, the orange ones on the picture, in this region known as the islets of Langerhans. And that triggers insulin secretion. So that's what we've said already, that if the blood glucose raises, we secrete insulin. And insulin goes directly into the blood plasma. Now, on all body cells, near enough, except red blood cells, we have what are called glycoprotein receptors. And those receptors are stimulated by this insulin. So when that insulin binds to the receptors, that's going to bring about those particular changes I've mentioned. So this is what the body would do. We have, so I'm just looking here at the moment, we have increased cellular respiration to metabolize more glucose. So we try and break down glucose a little bit more to lower its level. We specifically activate enzymes to convert glucose into fat, but also glucose into glycogen in the cells of the liver and muscle, which is what we said happens before. So that glucose gets turned to glycogen in the liver, and the proper scientific name for that is glycogenesis. Like I said, this would only feature at A-level. So again, we're going to try and bring our blood glucose down by turning it into fat, but also storing it away as glycogen. And the last thing that we also do, is push that glucose into cells, we absorb it into the cells, especially of muscle. Now there is something called sodium glucose co-transport. It's the way in which the body allows us to take glucose into the cell using sodium ions. And this happens more prevalently when our glucose level is raised. So as we've got here, insulin alters the tertiary structure of the protein channels and it allows for increased sodium co-transport. Basically, we allow for more glucose to get out of the blood and into those cells. And the whole reason why we do that, as we see at the bottom, is to get our blood glucose to fall back to normal. Now that's an example of negative feedback, because we're actually going to shut off insulin secretion then. Once we've returned our blood glucose to normal, insulin secretion is turned off, and that's a negative feedback mechanism. And I mentioned negative feedback mechanisms when I did a video on temperature control, but also when I did the video on the menstrual cycle, because estrogen and progesterone in that shut off FSH and LH. So there's many examples of negative feedback, and here's one of them. And basically the end point of all of this is to restore, as you can see from here, to restore our blood glucose level. Conversely, if blood glucose falls, then again, so we're now looking at the orange box on the top right. If blood glucose falls, this region, this islet of Langerhans detects that, but it's specifically those red cells on the outside, these alpha cells, that detect that fall. And now what we're going to try and do is the reverse of essentially what I've just been saying for the last few minutes. We're going to try and raise our blood glucose level. Glucagon, this hormone, this time is secreted directly into blood plasma, and receptors for it are only found on hepatocytes, which is the proper scientific term for liver cells. So I said on the slide previously that glucagon will take our glycogen and put it back as glucose, and that's what happens. Glucagon, secreted in blood plasma, activates the receptors, and what we get are enzymes being activated to convert glycogen into glucose, and that's called glycogenolysis, but also to get amino acids and other non-carbohydrates to convert those into glucose, and that's called gluconeogenesis. So we need to be clear the difference between glycogenolysis, and gluconeogenesis. Three quite difficult terms used in this video. So ultimately, I mean, the really important bit is we get this glycogen converted back to glucose in the liver. Now I've put enzyme activated. It's because glucagon works through what's called the secondary messenger mechanism, which I'll explain in another video. We also get glucose entry from the intestines back into the bloodstream to try and raise our blood glucose level. So what that does is increase our blood glucose back to a normal value. Again, that's an example of negative feedback, because we're going to then end up reducing our glucagon secretion. We're not going to, once we've raised our glucose level, we're not going to want to continually use up our glycogen stores. So we turn off our glucagon secretion, and what that will do is, again, feedback to get to set point, our normal blood glucose level. I want to just finish this video by talking about diabetes. Okay, so diabetes is a topic that often is taught after blood sugar control is taught, because what I've been saying in this video so far is about just normal blood sugar control. But in diabetes, now here I mean diabetes mellitus, and it's referring to blood sugar, because actually if you research, there is something called diabetes insipidus, but that's to do with water levels, which we're not talking about in this video. So in diabetes mellitus, or just diabetes, as it's often referred to, there are two kind of issues and two types of diabetes. And the treatment differs depending on which type we have. In type 1, or what's called insulin dependent, which we mainly get in young people, those beta cells are actually damaged. So there is an issue with producing insulin itself. Whereas in type 2 diabetes or insulin independent, it's not that we have a problem producing the insulin, it's just that the receptors have become less responsive to that insulin. So it's not so effective. Now for type 1 diabetics, because there is a problem actually producing the insulin, they would need, as we've got over here on the right, regular insulin injections. And monitoring of the blood glucose level is essential to make sure that you're not, or that you don't miss the injection, or that you are injecting the right amount. Type 2 diabetes, well, with type 2, lifestyle factors can massively come into play. So it's important with type 2 that you control your blood sugar by maintaining a healthy diet and actually eating the right amount of sugar. And obviously, as a given, you need to do regular exercise. Because injections wouldn't work, for instance, in this case, because in type 2, you do have the insulin, it's just the cells aren't being responsive. So you'd need to just manage that essentially yourself. There is a possible option of taking drugs to reduce the rate at which glucose is absorbed by the body. But usually in exam responses, you're looking for the kind of top 2. It's monitored by diet and exercise. So I've talked about cause and the treatment, but I'm not talking about the effects yet, because diabetes is manageable. Provided you have your diagnosis and you follow your treatment regimen, it is manageable. But with poorly controlled diabetes, these effects can occur to varying degrees. Now, hyperglycemia, which is too much sugar in the blood, can lead to severe dehydration. So it's important, if the blood sugar goes too high, that you're managing that with diet and exercise, or that you're taking the injection, if it's type 1, appropriately. Because of that dehydration, it could lead to extreme thirst, weight loss. Long-term diabetes has a whole range of complications. Blood vessels in the retina can be damaged because of just simply high levels of it. Nephritis or nephrotic disease or kidney disease can occur with poorly controlled diabetes. And peripheral nerves, so sort of that outer nerves essentially, can be damaged through poor blood glucose monitoring. I've just put here at the end about what can happen if there's too low sugar. If a diabetic were to over-inject, which is very, very common, because if they're worried that their glucose has raised quite significantly after a maybe carbohydrate-rich meal, then they could possibly inject too much. And that can lead to nausea, sweating, and even unconsciousness. But the key thing to remember, essentially, when we talk about diabetes, particularly when exam questions ask about diabetes, is to know that there are 2 types. One where there is a problem with insulin production, and one where the body has just become almost resistant to that insulin. Okay, so in this video we've talked about just general blood sugar control and insulin secretion from the pancreas, and just a bit of an overview over diabetes. Okay, I hope all that helps.